Okay, hello, good morning, good afternoon. I'm Avner Halperin. I'm the founder and CEO of EarlySense. Great to have NOAH here in Tel Aviv. And I'm happy to talk about AI, about data analytics, especially in the digital health spins. Because data and analytics save lives. And what we do every day and what our solutions do every day is help clinicians save lives. And we're in an exciting phase in our history as a company where that number of lives saved is growing tenfold this year. So I'll tell you a little bit about what we do and hopefully make it clear and understandable. So EarlySense is a company that developed a non-contact sensor, a sensor that collects data without ever touching the body of a patient. And by collecting that data, analyzing it, we can do predictive analytics and detect when something just begins to go wrong, alert a clinician, and save lives. We do that throughout the continuum of care, and the focus here, of course, is improving outcomes. Briefly, very briefly about the technology. You've all heard the fairy tale about the princess and the pea. So our sensor is the pea, and the patient is the princess or prince. They're all princes, by the way. Nobody has ever said they felt our sensor. So with a sensor under the mattress, our system can detect every heartbeat, every breath, every motion, continuously, constantly, throughout the time a patient is in bed, collect huge amounts of information, and use that to analyze health, predict deterioration, and save lives. Just to give you an order of magnitude, when you look at a hospital environment, 80% of patients are not continuously monitored. That means their condition is unknown for hours at end between the times where a nurse visits the patient. 5, 6, 8 hours between a nurse visit, nobody knows what's happening with the patient. Same thing, of course, in nursing homes and, of course, in homes. So in the 21st century, for most patients, most of the time, we don't know what's going on real time. And what EarlySense and companies like us are doing is bringing sensors into this field, collecting data continuously, and with that data and with that analytics, identifying the early warning signs of deterioration. For example, a patient after surgery gets pain medication. That pain medication can actually cause breathing to stop. That's called respiratory depression. And if a nurse comes in every few hours, she is very likely, or he is very likely to catch that too late. That patient needs to be intubated, or if it took a little longer, that patient may even die. Over 100,000 patients die unnecessarily every year in hospitals, okay? Meaning more than hundreds of patients every day, several patients every hour. And those lives can be saved just by collecting the data, analyzing, and finding the trends of deterioration, which is exactly what our sensor does. So this is, for example, a hospital implementation of our system, sensor under the mattress, bedside monitor, central station. All the data is analyzed continuously. Nothing ever touches the patient. Instead of 4, 5, 6 manual readings done by a nurse today in most general care floors and most nursing homes, instead of 4, 5, 6 readings, we get 160,000 readings a day. Very rich data set, a lot of data collected, a baseline per patient, personalized analysis, and then early detection of deterioration, activation with an alert to a nurse or a doctor, and lives being saved. And of course, as we do that, we collect huge amounts of data. So every patient our system monitors makes the next patient safer because we have more data to learn from. We have a bigger database, we have more reference, and we learn continuously. And by doing that, with every patient that comes in, we can compare his or her data to those of previous patients. So the value and the opportunity here of the kind of big data and predictive analytics is not in selling the data and not in doing smart statistics, but actually detecting very effectively the health condition of each patient by learning from history. And as a company today, for example, EarlySense, we have monitored more than 500,000 patients. We have the biggest continuous vital sign database in the world. Some call us the Google of continuous vital signs. And as more patients are monitored, more data comes in, and we get better and better in collecting and analyzing, detecting, and warning on deteriorations. And those are the analytics that we do. Now, today, in order to actually bring new technologies into the market, it's not enough to have a cool technology, of course, especially in the healthcare space. In the healthcare space, we actually have to prove results. And what we have done over the last few years, and companies like us, is actually prove in studies that when you put sensors into environments that didn't have sensors before, you actually get better results. You reduce deteriorations, you shorten the length of stay in hospitals, you prevent falls and pressure ulcers because we know when risk situations happen, and actually, by reducing cold blue events, save lives every day. In 2017 alone, our sensor helped save more than 1,000 lives in hospitals, and that number is growing to about 10x this year. But it's not enough to save lives. As difficult it is to say that as it is, as unfortunate it is, if you want to sell AI, you want to sell advanced analytics, you not only can build your offering on saving lives and improving care, you actually also have to improve the bottom line of the medical institutions that you sell to, and collecting the data not just on the clinical impact, but also on the economic impact is something that we as a company have done and published and show that every patient that's monitored with our system, more than $200 are saved per admission for a hospital, and that's what makes hospitals use our technologies more and more every year. That's why 500,000 patients have already been monitored, and that number, as said, will increase 10x this year. But, you know, the opportunity is actually even bigger. It's not just in the hospitals, it's not just in nursing homes. The biggest opportunity of smart sensing and analytics in healthcare is to take that technology to the home. In EarlySense, for example, what we have done over the last 2 years is take every sensor and algorithm capability that we developed for the hospital and ported it to our home environment. So instead of a monitor and large sensor, we now have a puck-shaped sensor that goes under a mattress. Instead of a monitor, we have the smartphone, and all the data goes to a cloud, of course, with complete and total protection of privacy under HIPAA protection. So the ability for the first time ever to give at-home medical care at the same level and quality and analysis as in hospitals is the direction of the future. And it's based on the ability to collect smart data and leverage the analytics developed in hospitals into homes, which is what we are doing today. And in doing that, as mentioned, we are building the biggest database and growing every day. We've also brought that technology into a new area, of women's health. For the first time ever, it's not only possible to monitor health conditions, but also detect fertility cycles of women with a non-contact sensor. So the same capability of very sensitive sensing that's used mainly for elderly in hospitals and now in homes is now also brought into the field of women's health as part of the expansion of digital health and analytics from the hospital to the home part. So as a quick summary, you know, what we are doing as a company, and companies like us are doing, is using contact-free continuous sensing to collect huge databases, develop advanced analytics based on that, and leverage that to improve clinical care and outcomes across the continuum of care. And we see a huge potential and opportunity for improving care as more and more data is collected and more data-based care is provided at the right place and at the right time. Last point I want to mention, I want to give a quick shout out to NOAH. That's the, the fund that takes Israeli companies' shares and gives them, when companies actually exit funds into education. We are one of the first supporters of NOAH, and I urge all entrepreneurs here to join us in making our success also the success of the education projects here in Israel. Thank you very much, and thanks for having me.